Good morning, everybody. I'm Sayukta from Beautiful Spotless Skin team, and I'm sure all of you must be keeping good health. To look beautiful and smart at all times is first of humans right from the beginning of civilization. Few of the very common conditions affecting the look and feel of a person is acne, hyper or hypopigmentation, and even hair loss. Out of these, acne is a big concern. Acne is a very common skin condition that can impact anyone, whether you are a teenager or an adult. This skin complaint is no stranger. Knowing the various types of acne can actually help us to treat the condition better. Acne vulgaris is a chronic condition affecting more than 85% of adolescents and young adults. It is one of the most common diseases affecting humanity and quality of life. It goes beyond just being a skin ailment to various psychological disorders such as depression, anxiety, stress, low self confidence, etc. Hence, it is important to know about the holistic treatment approach for this ailment. Despite its prevalence, few people know that June is Acne Awareness Month. Acne Awareness Month was launched to combat the negative stigma surrounding this very common skin condition and also to be aware of treatment approach for acne management. So let's connect today with our skin expert, Dr. Meghana Balikai, live from Hubli, to talk on different types of acne treatment and acne management. Dr. Meghana is a clinical dermatologist and cosmetologist based at Hubli. She did her MBBS from Jawaharlal Nehru Medical College, Belgaum, and MD Dermatology from Rajiv Gandhi University of Medical Sciences. She also did fellowship in cosmetology. Her expertise lies in various advanced laser therapy for various skin conditions, chemical peeling, PRP for hair loss, vitiligo, and also psychodermatology. She also worked in Derryford Hospital in United Kingdom for 7 years, where she worked in the Department of Psychiatry and trained in cognitive behavioral therapy and pharmacodynamic therapy. So she also has experience and does counseling of patients with both psychiatric disorder and chronic medical conditions. It's such a pleasure to have you with us, Dr. Meghna. A very warm welcome to you.
Thank you, Samyukta. Thank you for the nice introduction, and thank you for giving me this platform to go live and explain to people about the problems they have.
Actually, doctor, it's a pleasure. And, because we are going to talk about a topic which is very common and do affect the quality of life. And plus, it's just not the physical appearance that is, at stake. It's the psychological thing as well. And because you have done so much in this field, we will definitely like to seek your help in spreading awareness and, counseling people as well through this session. To start with, doctor, we would first like to understand what is acne and what are the various types of acne lesions.
Okay, it's always important to understand the disease first before we always talk about what to do when we get it and how to avoid it and what are the lifestyle changes and, to talk about things in the future. So it's always important to understand the disease first. So as you rightly asked, what is acne and what are the different types of acne? So what is acne is, in a layman, acne is a very medical term. So in layman term or a common man's term, it's called as pimples. And in different languages, they have different names, but in English, in a layman term, it's called pimples. So what is pimple? We all have, our skin, to begin with, it acts as a great protection from the outside world. So it creates a bubble to protect us from the outside world. So to do that, it has to have a lot of functions as well. So one of the functions to keep it going all throughout our life is to produce oil that is from the sebaceous glands. So everybody has sebaceous glands, but the number of sebaceous glands vary in individuals. Some have more and some have less. And also the amount of oil that each sebaceous gland produces also varies. So for some people, the production is quite sensitive, like any small irritation or use of certain things or eating certain type of food stimulates it, and then the production is more. So they tend to be called as a very oily skin. And people who produce less amount of oil are called as a dry skin. So there's a treatment for either of them. It could be very simple to very advanced treatments. So when these glands get clogged, there's a gland and there's a duct that connects it to the outside, so that oil keeps coming out and it keeps our skin quite and supple. So the right amount of oil is quite important. If it is excess, it will lead to pimples or acne, or if it's too low, it will cause dryness of the skin. So when does this pimple appear? These is mainly because of obstruction to anything that's outgoing. So if you apply a lot of creams, gels, serums, or cosmetics and things like that, it causes occlusion, and that will prevent the oil from coming out, and it will bulge, and that bulge is nothing but pimple.
Okay, so you have so well explained what acne is and how is it formed. Doctor, I would like to understand that is it just the overproduction of oil, or whether that get something is obstructing the outflow that it forms pimples, or there are other causes as well? I mean, that is definitely there, but there must be other causes as well, because we always hear that acne is a thing which is related to hormonal changes, etc. So what are the causes that attribute to acne?
One of the things that I told initially is use of the cosmetics or the external factors. So the external factors can be various things: use of cosmetics, use of certain creams and gels, or washing of the skin can lead to dryness. That in turn can lead to overproduction. That in turn can lead to acne as well. But there are internal factors as well. One of the most common things are genetic. So if the parents, the grandparents had lots of acne, so there's always chance that the next generation starts to have the acne at a very early age, and the severity goes on increasing. The occurrence of the acne and the severity keeps on increasing for every generation. So genetic is one of the reasons. Second important factor is hormonal changes, and it's always a well-known fact that a certain age group, that is a teenage, when the hormonal changes are occurring, are very common age group where we see acne. And other end of the acne appearance is during the hormonal changes, during the menopause or during the puberty, that is in teenage, during the menopause, and in between them we get during pregnancy in the case of women, obviously. So any hormonal changes, we have strongly seen that acne do appear. And even if you're in certain jobs, even that can cause acne. Like if you are in a job where where you have to deal with a lot of oils or grease and things like that, that also can cause. Even external environment can cause a lot of acne. If you are one of those IT people where you have to sit against the chair for a very long time, so occlusion occurs there as well. So in that, what we see is truncal acne is very common. So even certain jobs can lead to excessive acne. Even exposure to laptops or screens and things like that, that is infrared radiation, can also cause acne. So if we divide into broadly, it can be external factors or the internal factors. Even the diet also is quite important. So it comes under the external and internal factors which can cause acne.
Right. So a number of things can lead to acne formation. And the thing is that, many times we see some pattern over the face. Many times we'll see acne around the jawline or in the butterfly areas or, in the T-zone, etc. So does specific areas of acne on face mean specific causes?
Yes, I mean, there are certain causes. If it is happening in a particular area for a very long time, then yes, we can pinpoint to the factor saying it is one of these reasons why the acne are occurring, and knowing that is very important, so that the treatment varies individually when you treat the different types of acne. So if we go from the down below, if it occurs on the forehead area, it's very common for those people who have additional dandruff and things like that. So it's most commonly seen in teenagers, especially boys, or especially boys, which is very common because they have a lot of dandruff and they don't do a good hair care, or if they use a lot of hair care products, even some of the girls who use a lot of serum and hair care products where it trickles down their forehead. In such cases, forehead acne is very common. If you come to the cheek area, or if you come to the cheek area, it's more common again in the teenage age group where hormonal changes are seen. But more commonly in women, if it occurs in the jaw area, it is always related to hormonal. So in such cases, extensive investigation, what are the hormonal changes has happened, is quite important. And as I said earlier, it can happen at the back in terms of which job you're doing. If you're an IT person, if you sit against chair for a very long time, that occlusion can cause acne. So truncal acne is very common. We also see acne on the shoulders and on the other sides of the hands as well. In such conditions as well, acne are very common. So yes, depending on the type of where it occurs. So it's very common. We also see some students who keep coming regularly, who have acne because of occlusion, who keep their hand under the, especially the teachers or the students who keep their hand like this or in only one side while they're reading or correction. Because of occlusion, even we have seen acne in those areas as well. Apart from hormonals, jaw area acne is also seen in people who have keeping hand or fiddling with their face a lot in this area.
Right. And off lately, due to the mask and all, we have seen a lot of acne around the, area covered. I'm sure it's due to the same concept that you were talking about.
Yes. The occlusion is one of the reasons where in the mask area as well, occlusion happens, and you can see it there as well.
Okay, doctor. And doctor, many times we'll see whiteheads. Sometimes we'll see blackheads. Sometimes the acnes are really big bumps. They also have pus at times. So I'm sure there are various types of grades, whatever you call it. We'd like to know about that as well.
There are different people have classed acne in different way. Different classifications are there, but the easy one that will make the people or the viewers here to understand is it goes from a very mild blackheads to begin with, and then it comes as a whitehead, and then beyond that it comes initially at a very beginning. If you go at a very beginning, you can start feeling some pain in certain areas, and then you can start seeing reddish area, and then it becomes a blackhead, and then a whitehead, and then beyond that it becomes a small pustule. In certain patients, we also seen they become huge, very huge pustules, to an extreme conditions where they become very cystic. That is a huge bag which is filled with a lot of cyst inside. That is a serous or a clear fluid inside. So, and then this is the stages it goes through, the acne. So depending what is the severity that person is prone to, or all the other reasons why the acne has happened, it is seen differently, or it is displayed differently in different individual groups.
Fair enough. Doctor, a very general, psyche that we all have when we see acne, that is, that we'll do some home remedies, we'll try to fix it, or we'll ask a family or friend what they have done. We can go to the extent of following their prescription. We don't mind it. Or we'll go over the counter. I think that's our favorite. We'll go over the counter, get a cream, apply it, and wow, it's gone. So it's only when the condition goes out of control that we goes in front of a qualified dermatologist, when we see that, yeah, the symptoms has actually worsened, or other things have also added to it. What's your take on home remedies, or consulting a friend or family, or going for over-the-counter medication?
I would always say that it's always right to get information from a person who is really learned in that field, then rather than trying things that somebody else has tried. Because as individual, we're quite different from one another. For example, it also happens one of your friend goes for a treatment of treatment of acne, and using the same cream, that person will have got really beautiful or clear skin. It may not be the same results with a friend you're referring to, because it may cause a little of side effects as well. Treatment is quite individual, so it's always better to get an expert advice before you try anything new. It could be just one visit where the pimples are very simple. You can get treatment with one creams, and we may explain to them on how to treat them or how to take care of their skin for a very long time. It's not necessarily, a lot of people are scared of coming to doctors with a view that will I be addicted, or would they do things that will be that I have to go to them for a very long term. No, it may not be that. We may see you for once off, and we may tell you all the things that are useful to you by seeing what type of skin, why you have pimples and things like that, and treat you one off. So pimples will occur to majority of people. 99% of people will have pimples in their lifespan, either one or the other way. But then getting a good treatment is quite essential only if you're intending to have a beautiful and a clear skin.
Right. And yes, as you said initially as well, that, acne could be due to various factors. What was acne on my skin may be different from what others are getting it for. So no way of sharing the same prescription. So definitely the approach would be individualistic. And for that, we need to go for a qualified dermatologist. Again, over-the-counter medication, doctor, because most of us, do that. But it leads initially, I don't know for what reason, but the creams do magic on our skin and we feel, yeah, this is what we were looking for. But then we'll see that we have fall addicted to that cream or, whatever the chemist have suggested us. So how harmful over-the-counter medication can be for us?
Whatever I'm going to say, it's no offense to any person who is dispensing the medications or the creams over the counter, because they may have a good knowledge, they may have read about it, or they may not have read about it. But then there are certain people who gain a lot of knowledge from over the counter. Is if I have a medical shop near to my clinic, so he would know my pattern and he would suggest the same thing. And I would still say the same thing is he would just go by the intuition, this would work. Where in versus with expertise, he would say this will work. There's a difference of would and will. So it's always better to go for, again, a good advice and then start the treatment. Because sometimes we are also seeing that excessive use of certain creams have got an adverse reaction. So wherein the saying goes, stitching time saves nine. If they would have got the treatment early on, the treatment would have been much quicker, much better, and the scars or the problems would have not got that worse.
Right. So we can save our energy, our time, our money, and most importantly, our skin or our health by going to the doctor at the right place. And as you said, many a times acne could be due to some underlying medical condition. Only a doctor can tell us, after proper diagnosis, etc. So it's also important to rule out that, nothing some parallel condition, medical condition is also not popping up. So it's always advisable to go to the right person, which is a qualified dermatologist. Now, doctor, we would also like you to shed some light over the treatment options available for treating acne.
Okay. When a patient walks through my clinic and we observe their skin and they have their complaints as well as to have acne, apart from knowing acne and me being with a psychiatric background, I also advise them that these are just skin related disorders. They are only related because, or they're bothering you only because of cosmetic reasons. Don't go so spend spree, or don't go really mad about keeping it really clean and clear. No, daag achhe hai, it's okay. So it's important for everyone to know that it's okay to have pimples to begin with. You may have pimples one or other. That's okay. So first important thing is to learn it's okay to have pimples, but then we are always there to help you to get it clear. So don't, because of the social media and the thing that we're looking for is a perfect skin or perfect face and things like that. Please don't fall for that thing as such. But then we do have a lot of treatments for pimples, beginning with blackheads. Then we can do, we call them as comedones, the open comedones and the closed comedones. So we can do a little small procedures for that, wherein we do a comedone extraction. These procedures, what I'm saying, may also be seen in a beauty parlor or the salons and things like that. It again varies wherein you get it done. You don't want to keep those pores open for a very long time, then that can cause excess more side effects as well. So again, getting it done at the right from right place is important. So we do that, or If they're not very excessive, we can start with very basic creams of clindamycin, niacinamide, or benzoyl peroxide. We can treat them with very mild creams to begin with. And if the results are quite good and the patients are quite happy, then we leave it there and we explain to them on how to look after it in the future. So that's in the first two grades. Then when you have more and more pimples, that is pustules, or you may start seeing scars, in such patients, we may go further ahead, wherein we start adding oral medications, because we have to reduce the sensitivity of the sebaceous gland, or if there are hormonal changes, that also has to be tweaked in and made correct. So hormonal changes has to also be set right. And we, in such cases, we either give long-term treatment which lasts for about 3 months with either oral antibiotics, that is tetracyclines or minocyclines, or lamicycline. It is not a short-term procedure treatment. It should last for at least 3 months. Or in worse situations where they're cystic and things like that, we also do add retinoids like isotretinoins and things like that, which has its own side effects. That is, it can cause a lot of dryness of your skin and lips and things like that, which can be fixed with a very basic lip balms. Along with that, again, treatment again varies if they only come as a first time with acne, or do they come with acne and scars and things like that. So again, there are a lot of laser treatments available, very basic chemical peels or lasers like IPL and DIAGs. All these are available to treat not just the pimples, but along with them the scars, the carbon dioxide lasers for scars. We also do PRPs for acne scars. Or thread lift as well for acne scars. So lots of treatments are available, but that depends on what exactly the skin problem is there with the individual. Whether it's just simple comedones or macules, papules, pustules, cysts, or scars. So there's a wide range of treatment available for any of those pimple problems.
Okay, doctor. And yes, acne is something which goes beyond just being a skin ailment and to various psychological disorders, as you mentioned. So yeah, people many times goes into anxiety or depression or a lot of stress and low self-confidence. And because, again, market is the market gimmick is so that they'll say that unless and until you're spotless, no one can spotless in reality, but unless and until you are spotless, you can't be in a picture, you can't be in a photograph, or you can't exist. So that's so heavy on our heads that we go into depression. And definitely counseling is very important. It's just a skin ailment. I mean, it's just about the appearance, right? But definitely treatments are available. What we need to do is to go to the right person at the right time, which is a qualified dermatologist, as soon as we spot something which is not normal asking. Now, doctor, as you very well mentioned, there are treatments and procedures for acne and for acne marks and acne scars. Now, the thing is that whoever had gone through this would understand that treating acne is one thing and treating scars and marks left behind is another. And many a times we feel that acne treatment was easier than treating these scars and the marks. Now, is there anything that we can do to prevent these scars or the marks, the pigmentation thing that is left behind by the acne? Any way to prevent it?
The best way to prevent acne is not to have acne. Okay, so it is very important that even if you start having acne at a very small acne, so treat it earlier, then they don't leave behind any residual, because any acne that occurs has to leave behind one or the other residues. So if you treat that acne that comes quite ahead of, if you treat them quite well in advance, as soon as you see them, then you can avoid all the scars that is possible. So it is very important to treat or to have a good routine to your life to make sure what is the thing that's causing you acne. Like there are certain professions wherein they have to apply a lot of cosmetics and things like that, and that obviously can cause clogging, and you cannot tell them not to use cosmetics. So in such cases, prevention is the minute you wash your face, let the skin breathe. So just before you retire for the day, wash it off thoroughly and use a mild benzoyl peroxide or nicotinamide, or even clindamycin. All these things will just keep it going. And in an age group of less than 30, 25 to 30, things that you can use also vitamin C serum. And beyond that, you can start using a little retinols. It will prevent both tropical retinols, which will prevent both acne and help you in your anti-aging as well, or tretinoins. So these are the certain basic things. If you start doing it at early on, if you're a known person who prone for acne, then such small steps are quite useful. Wash your face thoroughly. Don't wash it too often, or too less. Anything too less is or too little is too bad. So don't wash it too much that you end up having drier skin, and your skin thinks there's so much dryness that you end up producing a lot of oil, and you end up having more pimples. So just wash once or twice a day, and use a good sunscreen, good moisturizer, or a good cosmetics. All these things does affect the appearance of pimples, the appearance of acne, and which in turn prevents you from having any acne scars.
Right. And what else can we do to maintain a good skin regime or a regular, skincare routine we can follow to keep our skin healthy, doctor?
If you're a social media person, then I don't think I'll be probably justifying a lot of things that keep popping. They keep showing all the serums, how to use them, and things like that. So I think it's a little overrated on how best you should look after your skin. Amount of things that they put on their face the minute you wake up to the afternoon, and the bedtime routine and things like that. I think they're a little overrated. So keep it simple, and always the good old nuskes or the good old things are quite important. Just wash your face in the morning thoroughly, nicely. Don't scrub it all the time. Scrubbing once a week is enough. You don't scrub the skin more than once a week. Wash it at least twice or thrice a day, and that's a morning routine. Don't forget to use sunscreen. Sunscreen should be used religiously and every day. And each sunscreen only works for 4 hours. It won't work beyond 4 hours. So if you're there outdoor, or indoor as well, just reapply the sunscreen after washing your face. If you're one of those person who cannot reapply or you cannot wash your face before your secondary application, you do have acne pads that are available, which have inbuilt nicotinamide, or just a good wet wipe. Just cleanse your face and just reuse the sunscreen. Use any cosmetics that you want to use, but which says non-comedogenic, or which are safe, or which can be used by even acne people. So try to see the label, what it says, because we don't want excess moisture on your skin or excess oiliness on your skin, which can produce, or it can stimulate more production of acne. Then in the night, just as I said earlier, let your skin breathe, wash your face thoroughly, and as we discussed earlier as well, if depending on your profession, what you do, use very mild clindamycin, nicotinamide, or benzoyl peroxide on your face at night. Or if you're one of those who have been using a lot of, who have been having a severe acne, then they would have been already told about what else to be done apart from in terms of using retinoids and things like that. So that can be followed as well. So don't overdo any of those things. Or use of a lot of serums, buying a lot of things off the market. Too much would definitely probably cause more harm to your skin than benefit.
Right, you have very rightly said. There's so much of there are so many influencers who are endorsing products. Plus, there's this market gimmick advertisement everywhere, and definitely we fall for it and end up buying like 50 to 100 products for our daily skincare routine. So we just need these simple, basic things and maintain it. That's the way to go for it. And definitely, in case of trouble, go and contact a qualified dermatologist. Now, doctor, I would also like to ask, as you also said, that it's important to follow a healthy lifestyle. So how important is a healthy lifestyle? What is the definition of a healthy lifestyle, and the importance of diet in it? Because we have heard that if you have acne or you are prone to acne, please avoid these things, or there are dietary precautions that we hear every now and then. So what dietary precautions we should take care of, and a healthy lifestyle?
Okay, diet is quite important, not just for acne, but for overall health of an individual. So when it comes only specific to acne, what we suggest is avoid whites. Whites can be anything like maida, the cheese, the sugar, or some of the butters or dairy products. So whites do cause, both the sugary products and the dairy products do cause a lot of acne in certain individuals. So if you see a pattern that you're consuming certain food, especially the whites or the cheese or the dairy items, just avoid them. It does help you in that sense. The next thing is avoid fatty diet, deep fried or fast foods and things like that. Apart from antioxidants, apart from oxidants that is producing and things like the junk food, and apart from that, it does increase your weight. So weight has a direct connection to pimples, because we see a lot of people who do have PCOS in the background, that is polycystic ovarian disease, especially women. We do see them that there's a triad where there's weight gain, there's acne, and there is also excessive growth on the skin. So it's quite important for such individuals to avoid gaining weight in terms of to avoid gaining weight, because it will in turn cause a lot of PCOS, and it's a cycle. You eat fatty food, you gain weight, that will stimulate your sebaceous glands and you get more acne. So this cycle has to be broken by following healthy habits. So one is avoid any fatty food, any whites or any deep fried or junk items. The second is not just intake of any of such foods, but also exercising enough. You should let your skin breathe and the skin should clear. So exercise means wherein you sweat nicely. So a healthy sweat is quite important, so that your skin flushes all the things that are not needed from it outside, and you start getting a healthy start to the day for yourself and for the skin. So exercise is quite important. It can initially, they can start with 45 minutes of brisk walk, then or a jog, then a run, or they can join any gyms and things that way. 45 minutes just for taking out for yourself to have an overall betterment of your skin and body is quite important. So yes, along with diet, exercise is also equally important.
Okay. Now I'll quickly go through the questions that have been asked by our viewers. So Sohana Thakur is here. Her question is, how often should I schedule my follow-up appointments to monitor my progress and adjust the treatment if needed?
Initially, if you, hi Suhana, initially if you visit a dermatologist for a very basic comedones and things like that, then once or twice, at least minimum 3 months is what we say to visit, so that we can give you a clearer skin. But if it is a severe case, or if it is a patient with a lot of severe hereditary or genetic problems, then probably you may have to come for a longer time. But then as and when you come, we'll be able to assess your skin and be able to tell you how often you have to visit the clinic as well.
Right. Sharaya Sen is here. Her question is, can stress or anxiety worsen acne?
Hi, Shanaya. Yes, stress and anxiety, as I said earlier as well, they're interchangeable. Some of the psychiatric problems, some of the mental health problems can cause skin problems. One of them is acne, or the acne in turn can cause anxiety or stress. So they're interchangeable. So yes, maintaining a good mental health. If good mental health is not maintained, then it is visible on your skin. So skin as such is a window to anything that's happening inside internally, in your physical health or your mental health. So skin is a good window to understand what you're going through as well.
True. Purvi Mehra is here. Her question is, what should I do if I have sensitive skin but still want to treat my acne?
Hi Purvi. People with sensitive skin have to take things very slowly and gently as well. We do suggest that in a certain creams not to be used, like retinols oral or topical retinols cannot be used. But very simple things like clindamycin, niacinamide, benzoyl peroxide can be used. But in turn, if the situation arises where you have to use retinols, then what we do is we ask them to use in a very smaller quantity and the exposure of your skin to that medications also has to be in a smaller duration. So you can initially start applying all over your acne marks and acnes for a very short duration of time, that is for half an hour to 1 hour. Then take it for a very long time, about 1 week. If you then slowly what we're doing is desensitizing your skin for such creams. So we can use all the products that are available, but probably the length of or the duration of the treatment may be a little longer. But all the treatments can be used, but with caution.
Okay. And John,
redness as well.
And one last question by John. His question is it safe to combine different acne treatments for better results?
Yes, we do have a combined treatment for better results. For example, if along with topical, we do give oral medications. Along with just medical form of treatment, we do a little cosmetic treatment, as in terms of use of chemical peels, or we may combine them with lasers. So yes, a combined treatment, depending on the individual, it is okay. It is not contraindicated, or it can be used safely.
Okay, doctor. Now, doctor, how important it is, because you have already said that using sunscreen regularly, religiously is very important. How important is sunscreen part of the treatment or post-treatment procedure for acne? Because we have heard that many times, after lasers and all, we are advised to apply sunscreen. But then people say that, sunscreens make my acne worse or make my skin go patchy or dull, etc. And they don't use it. So how important it is?
First is, sunscreen is very important for your skin, not just for people who have pimples and things like that. Sunscreen is important for people who are in Indian subcontinent, because we do get exposed to sun, so it can prevent you from various skin problems, things like melasma, acne, or any blemishes or freckles. It can postpone freckles. Along with that, it can also postpone anti-aging. So it can be used as an anti-aging as well. So sunscreen is quite important. Even if you don't have any skin problems, just use sunscreen, so that you can just postpone your aging or wrinkling effect. So yes, sunscreen is very important. As I said earlier as well, sunscreen only works for 4 hours. So once you apply sunscreen, and the sun that you have to avoid is between 10 to 4. So if you apply sunscreen at 10 o'clock, it will last 1 to 2. Then reapply the sunscreen, that will help you throughout the day. So twice a day application of sunscreen is quite okay. It's quite justifiable. So yes, sunscreen is quite important for people who have Now the question is, what type of sunscreen should be used for different people? It varies with your individual skin texture. So for people who have acne, we advise them to use a non-comedogenic sunscreen or a gel-based sunscreen, or in such cases, you won't have excessive moisture to cause pimples or clogging. But when people complain that this sunscreen is causing me more pimples, that is only for the fact that they're not using a right type of sunscreen for their skin. So it's quite important to use the right type of sunscreen to avoid not just pimples, but any skin problems.
Okay, doctor. And before we sum up the whole session, any take-home message for our viewers?
Do take your skin seriously, but not too seriously to go really crazy about it. It is important to look good and beautiful, both physically and mentally. So please do take care of your skin. Please do follow the tips that I have already told, and don't do anything excessively. Don't do anything out of hastily. There are certain tips that are available online to how to get rid of pimples overnight and things like that. Please don't do that, because we do see a lot of patients who come with burns. Don't use anything that you don't know or you cannot be very sure of. So please take advice. Nowadays, being online access and things like that, everyone is available online as well. If you don't have enough time to go and meet them physically, online consultations are available. So do at least take that advice to prevent long-term problems with your skin. And as I say, stay healthy and stay beautiful. Thank you.
Thank you so very much, Dr. Meghna. It was wonderful talking to you. Thank you for your valuable time and a very informative session. Thank you so very much.
Thank you so much as well. Thank you, everyone. Have a great day.
Thank you, Doctor. And viewers, thank you for your active participation in today's session. Stay connected to our beautiful spotless skin page. Stay healthy, stay happy, stay beautiful. Goodbye.